In this lecture, we will discuss what the transitional zone is and how to determine it. The precordial leads or chest leads look at the heart in the horizontal plane. V1 gives the most rightward view of the heart, and lead V6 gives the most leftward view of the heart. So if you look here, this is lead V1, okay, and this is lead V6. And as we go from the right side of the heart, all right, this is our right atrium, our right ventricle, the most anterior portion. So from the right side to the left side, we get to more of a leftward region, okay? Now, because the bulk of the ventricular mass in normal adults lies within the left ventricle and lead V6 overlies the most leftward region of the heart, we will see the greatest ventricular vectors as we move across the precordial leads from lead V1 to V6. In other words, the QRS complexes should become more positive as we move across those leads from right to left, okay? So if you look here, we said our right ventricle is over here on the right side, and as we move more leftwardly, the bigger, the bulkier the mass will get to a more greater R waves and greater QRS complexes because of that greater mass of the left ventricle. And if you look at these EKGs, you can see them, okay? There's a small R wave there, all right? Here's V1, V2, V3, V4, V5, and V6, okay? So we're going from the right side to the most leftward side, and notice that it slightly gets bigger in duration, our R waves, okay? And it should do that from V1 to V5, okay? And in left, and here's V6 as well, but normally when we talk about the R waves getting bigger, it goes from V1 to V5, and we'll talk about that when we discuss R wave progression, okay? And same thing down here, smaller R waves, and they slowly are getting bigger as we move more leftward across the heart, okay? So notice that, again, from right to left, the left ventricle has a greater mass, so normally it should have these greater R waves in those leads. Now, when we talk about the transitional zone, this is the precordial lead where the QRS transitions from being mostly negative to being mostly positive. The actual transition is where the QRS complex is isoelectric, meaning positive and negative equally, okay? So again, actual transition is where the isoelectric is, so meaning if you were to imagine this, not drawn perfectly, but again, if this portion here were equal to this portion, that's where, and that would say in lead V3, that would be our isoelectric or transitional zone, okay? Now, we don't often see that in cases. So if you looked here, okay, we're seeing mostly negative, mostly negative, mostly negative here compared to its positive counterpart, okay? And then we see mostly positive, okay? This positive portion is greater than that negative portion. If you look at the bottom, again, mostly negative here, mostly negative, but then here becomes mostly positive, okay? It's much greater than this S wave here, so the transition is at that point. Now, after we find this transitional zone, then we need to classify it. The transition is considered normal if it occurs between leads V3 and V4, okay? So again, between V3 and V4, here's the normal transition. Here's V3 and V4, okay? And then on the leads, we'd say we want it between this lead and this lead, okay? V3 and V4, that transition. It is considered a counterclockwise rotation if the transition occurs before lead V3. And this is also referred to as an early transition or a rightward shift. So now we're talking about the transition before V3. So before that, meaning it's coming somewhere in this region, okay? So somewhere here. And then if we were to look at our leads, it'd be either V1 or V2, somewhere before this region, okay, is where our transition's taking place. And what I want you to notice here, here's our left ventricle here, okay? I want to orient you. This is the right ventricle. This would be the right. This is the left. This is posterior portion and the anterior portion, okay? So imagine the person's legs down here, okay, their head back here, all right? This is their right arm. This is their left arm, and they're lying on the bed, okay? And you're looking up from the foot of the bed and looking up at them. The left ventricle is sitting pretty much, think of on the bed. This is our bed portion. It's sitting them, and the right ventricle is the more anterior portion, okay? And so when we talk about these clockwise rotations, okay, we said if it's before V3, we call that a counterclockwise. Well, imagine this is a clock. Here's 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock, okay? If it's occurring before V3, we call that a counterclockwise, okay? And think of your clock. It's going counterclockwise, opposite of the normal direction, okay? So again, transition before V3, we call that a counterclockwise or an early or rightward transition. And now lastly, if the transition occurs after V4, we call this a clockwise rotation, a late transition, or a leftward shift, okay? A leftward shift, okay, so that's after V4. Think about it, we're going to the left side of the heart, all right? Late transition because it's occurring later than it normally should, and also a clockwise rotation because here's V5 and V6, okay? That means it's going this way. We call that clockwise, going in the normal direction, okay? Now let's go over our examples here. We can see that we have a normal transition in the top image, this top one right here, all right? In other words, the transition of the QRS complexes from being mostly negative to mostly positive occurs between leads V3 and V4. Okay, let's look at that. Let's erase this again. So remember, normal is between V3 and V4. Again, we're saying this, okay, is mostly positive. It's almost actually isoelectric, so maybe the change, you can certainly see that this is mostly positive, okay, but these leads look almost isoelectric, okay, so maybe the transition's actually at V3, all right. It's certainly before V4, all right, and it's certainly after V2 because this is negative, so the transition may actually be at V3, and because of that we call that a normal transition, okay? It's in that normal region between V3 and V4. Now, in the other example, the one below, the QRS complexes appear to become more positive between leads V2 and V3, making this a counterclockwise rotation or an early transition, okay? So again, let's just erase some of this here. So we have in lead V1 mostly negative, okay? Lead V2, again, it appears that it's mostly negative. This portion still the S wave still greater than that R wave. However, once we get to V3, it's mostly positive compared to the negative portion. So this is positive, this is negative. That means the transition occurs somewhere between this region, which is ahead of V3, okay? And because it's before V3, we call that a counterclockwise, okay? Right? It's happening before, so we're going in this direction, counterclockwise, or an early transition, or again, rightward, because we're moving towards the right side of the heart. Okay, just a few final words. Transitional zone is highly dependent on lead placement. If the chest leads are placed too high or too low, it can result in an abnormal transitional zone. In addition, anatomical variation can account for an abnormal transition, such as a vertical heart, which is not uncommon in infants and young children because that right ventricle is dominating, okay? Now, clockwise rotations or late transitions tend to be more clinically significant and may be associated with an anterior MI, COPD, dilated cardiomyopathy, and other heart diseases. However, it's also possible to have some form of pathology with a counterclockwise rotation, okay, that rightward shift, such as in the setting of a posterior MI or right ventricular hypertrophy. The main thing here I want you to remember is that the majority of abnormal transitional zones tend to be due to misplaced leads, okay? So just make sure to be aware of that. All right, let's briefly review what we discussed before we end. So the transitional zone is the precordial lead where the QRS transitions from being mostly negative to mostly positive, okay? And we want to find that. So from negative to positive, and we want to find that portion right in between, that isoelectric area. That's where the actual transition occurs, okay? Now, if the transition is between V3 and V4, like we saw over here, we saw it in V3, that's a normal transition. However, if the transition occurs before V3, we call that a counterclockwise rotation, okay? And we saw that over here where it occurred somewhere before in this region here. So that's before, we call that a counterclockwise rotation, an early transition, or a rightward shift, okay? Now, if the transition occurred after V4, we would call that a clockwise, okay, heading in this direction, or a leftward shift heading towards the left side of the heart, or a late transition, occurring later than normal. Now remember, the clinical significance, the main thing I want you to be aware of is this misplaced leads. If the leads are placed too high or too low, and remember, this is not a precise practice, so we're not we have so much human error that it's not uncommon for us to misplace the lead just slightly and cause this, abnormal transitional zone. They could also be due to anatomical variations, such as the vertical heart. Remember, the clockwise rotation tends to be more clinically significant than the counterclockwise rotation, so the leftward, okay, because we tend to see more leftward problems, okay, such as with heart disease, COPD, and anterior MIs, okay. But you can also have problems with the counterclockwise rotation. We mentioned posterior MI and right ventricular hypertrophy. Well, that's the end of this lecture. We discussed what the transitional zone is and how to determine it. I hope you learned something.